Essential oils and herbs can play a big component in helping with bone health, in preventing osteoporosis, and as reversing osteoporosis. It's a bigger part of the program that I'm introducing you to. But without any doubt, why they're so beneficial is because they have so many effects around the body at the same time. For example, they can be estrogenic, and we know that low levels of estrogen in postmenopausal, perimenopausal can drop bone density dramatically. They're anti-inflammatory and antioxidant, which both have dramatic negative effects on bone density. And then they alter the bone building pathway, so to speak, the osteoblasts and osteoclasts that I've talked about so many times in the videos that I've put up. And the fact is they've got multiple components in there, multiple compounds. One essential oil, for example, or one herb isn't just one little chemical. It's a mixture of dozens, even hundreds of combinations. And they all seem to have these little effects throughout the body, particularly to do with long-term chronic health conditions like bone health. And of course, there are multiple pathways that they influence. It's not just one thing, putting calcium on the bone. It's the whole restructuring and stopping the calcium coming off the bone, putting it on the bone, and getting all those mechanisms talking to each other. So they can play a huge role. Now, the one thing about essential oils is there is nowhere near as much information on essential oils and bone health, only because it's really started in the last 10 years or so. But what research is coming out on essential oils is showing a very positive effect. Now, in most cases, the essential oils have been done on cell studies. So they put it in with cells and see how the bone cells develop, and or a few on animal models, so animal tests, but none on human. And on all of the animal ones, it's been added to food. So it's not as an aromatherapy, it's an added to food. Now, on that, you always make sure if you add any essential oil, it's food grade, and you talk with professionals about what you add. But the message is they're effective, and I have no doubt in another 10 years, there'll be evidence to show that applying them directly to the skin, which we know in many other bone conditions like pain, osteoarthritis and so on, and pain, they can have a beneficial effect. So what we've got here so far in the research is the essential oils coming from cinnamon, main one called cinnamaldehyde. And in the cell study, so they've done mice and some rat studies, but they've done some cell studies, and they showed that it increased bone metabolism, mineralization, building bone by 3 times the normal level. So it's a real win-win situation. Rosemary oil, thyme and sage, which were used both as a powder and as an oil, so added to food again, which contains something called carvacrol and thymol, and these are some of my favorites in here, were also adding to all of these. Now, I've just summarized the list of the benefits. I haven't told you specific ones because at the end of the day, they all increase the osteoblasts, they decrease the osteoclasts, which take the calcium off the bone, they increase bone mineral density, they're anti-inflammatory and antioxidant, and have multiple effects. So both these ingredients coming from rosemary, thyme and sage, and you'll often find that these ingredients specifically that have been tested will be in lots of other herbs and spices too. For example, with marjoram, it's got one specifically called saponine, and that in the cell studies showed that it increased literally the bone mineralization, not as much as the cinnamaldehyde, but it definitely did. Now, marjoram will also have carvacrol and thymol because they're all related. Lemon essential oil and oranges have something in them called limonene, and in the limonene, in this case, it increased, in that same study that was done over there, increased bone mineralization by 2 times. Now, of course, you can get this in food too, and the highest concentrations of limonene is in the peel, and that's why in Chinese medicine they use a lot of the peel, sometimes called chen pei. And at our home, we actually collect our own peel, dry it, and use that as one of our supplements too. So we've got limonene, another one called pine oil, and that has something in it called alpha-pinene, and again, lots of other ingredients in there too. And alpha-pinene, that gives it that strong pine taste, smell that you can get if you smell a pine essential oil or a conifer. And then finally at the bottom, one of my favorites, of course, of all time is eucalyptus. And I've been using eucalyptus oil for various things for about 50 years now. And eucalyptus oil has something called eucalyptol, and eucalyptol has been shown, like all these, to increase osteoblasts, decrease the osteoclasts, which take the calcium off the bone, increase bone mineral density, they're anti-inflammatory and antioxidant. So they have this broad approach to improving bone health in conjunction with all the other aspects that I've been showing you in the other videos. So make sure you're checking out the other videos that show you a really complete picture of how to reverse osteoporosis. When considering herbs in osteoporosis, the best place to start really is traditional Chinese medicine. There is so much evidence and information on it. Yes, lots and lots of studies on it. And in Chinese herbal medicine, there are something like 33 compound formulas that are traditionally used. They all have their own unique name and all have their own unique combination, often overlapping in the herbs. And I'll show you some of the herbs so you can look for some of those when you look for some of the formulas. And the best place here is to work with a Chinese herbal medicine or a herbal medicine specialist that you can find. Lots of people around can help you with these and have been trained up in this area. Now, in each of these individual herbs, like all the herbs I'll be talking about, each of them though have multiple compounds in them. It's not one herb like astragalus and, oh, hold on, it's got one astragalus in there. No, it's got dozens, if not even 150, maybe up to 200 different compounds. And each of these compounds target different pathways for osteoporosis and fortunately other diseases as well. So you have these going in targeting the 20 or so. There are 20 or so different pathways that link and cause or contribute to osteoporosis and or its prevention. And modern medicine often targets one or two and as a result tends to have lots of side effects. The benefit here is that they target lots of them. And then when you combine them with other herbs, which have stood the test of time, thousands of years of trial and error, then you know you're targeting many in multiple pathways that are stopping, preventing and reversing osteoporosis. That's why they're so effective. Now, first of all, there's thousands of years of evidence collected. The safety record is impeccable in the scientific studies nowadays as well, but over time, and there are literally thousands of clinical studies and tens of thousands of studies on these herbs, the combinations and mixtures for osteoporosis. The main herbs that show up in these combinations and mixtures and compounds and that have also been individually tested include these ones here. These are the major ones. Now, there are dozens, maybe even hundreds. But if we look at it, it's Radax astragalus, often known as astragalus. That's the way I know of it, and I'm no herbalist. I'm just the researcher, so please excuse my pronunciation of some of these terms. Radax et rhizoma, Salvia militarisea, also known as Danchin. And with Danchin, there's more than 40 clinical trials. That means there are more than 40 trials specifically done on humans, not to mention the hundreds and hundreds that have been done on the cells, the mice, the rats, and so on, building up to this evidence and the test of time, of course. But showing you how it fixes or works on multiple pathways. It's antioxidant, anti-inflammatory, and it's mitochondria protective. Now, the mitochondria, I hope you've seen my other videos because this is about the big picture of osteoporosis, and I'm trying to cover every single aspect on osteoporosis, and you'll see that I often talk about the mitochondria that are the powerhouses of the bone cells, and they're the ones that, if you've got lots of energy in the cells, you've got lots of energy in the body. So our own energy, feeling of energy, but also here. You also see that it has cerebrovascular, so it gets the blood flowing, kidneys and bone are closely linked in Chinese medicine, but also when you look at the results, both are very linked in many of the clinical studies. There's more than 40 clinical trials, over 100 different compounds that have been used or identified in Danchin. And then you've got Radax aremini preparator, and there's 120 clinical trials and over 140 compounds in that one herb. So it shows you the level of evidence and the level of benefit you're potentially getting because of that combination. Herba empimedi, also known as horny goatweed, you can imagine why, probably increases circulation in certain parts of the body, and has more than 100 different clinical trials just on this one herb. It's got 60 different compounds, and interestingly, the major compound is one called Ikarin, and if you look up Ikarin, you'll see that is used specifically just for osteoporosis. Wow, that's pretty amazing, isn't it? And in biochemical medicine, they're looking at ways of getting the Ikarin putting in some chemicals to it and then being able to patent it. The last one, and these two are often used together, is Fructus ligustri lucidi. More than 3,000 studies, which include the cell, the mice, the rats, and of course the human clinical trials. And these basically show that it's kidney, bone, and collagen, which we know are linked together, and it works on all three of those areas together, which is a bonus. So what do they all do? Well, I could have gone through each one of these and put up a board on each. You would have got really bored, so I've summed it up pretty simply here. There's overwhelming evidence of the benefits, and the combination mixtures are even better. They have this synergistic effect. And what they show, either independently or together, but better when together, mixed, if they're anti-bone resorption, so they stop the bones being resorbed. In other words, they decrease the osteoclasts, which take the bone off in the normal recycling process, but they also increase the osteoblasts, so that less is taken off and more is being put on. But what's great is it improves calcium balance. In other words, the extra calcium that's floating around, often in the plaque in the artery that causes heart attacks and strokes, is also removed, yes, removed and put back on the bone where it should be. So it's rebalancing. Now, again, they're using multiple pathways to achieve this same aim. So it brings back the calcium. Even in the experiments they've done with mice and rats and in humans with low calcium intake and so on, all of them show that the calcium was being taken, the extra calcium, a little bit of calcium there was still being used in the body. It's taking it from the places that shouldn't be and putting it in the other places. It increases bone quality and bone mechanical properties. I could list dozens of other benefits directly related to bone that I can go through some of the chemistry and other bits and pieces, but it's not worth, because at the end of the day, it works. They're really effective. There are literally thousands of chemicals in all the herbs and spices and essential oils that I've already mentioned. But there are some that have been isolated and been used and specifically tested and show up very positive results. And these start with curcumin. These are a group of chemicals called polyphenols. These are the big plant-based molecules that you get, and when they go into the gut microbiome enhances them a little bit more. You get the multiple benefits, and of course it benefits the gut health and so many other places, because you know the benefits, for example, of curcumin on Alzheimer's and across the board cardiovascular disease, decreased cancer rates. And it helps with bone health as well, not just because it's anti-inflammatory and antioxidant, but all of these have positive effects on the osteoblasts that put the calcium on the bone and lowering the osteoclast, and all through multiple pathways that I've already mentioned. But curcumin, which is a turmeric concentrate, and you can get bioenhanced ones, absolutely fantastic. Resveratrol, which comes from the major component comes from the red or dark grape skin and so on, and hence why people talk about it in red wine, but you don't get enough to help your bones, of course. Green tea extracts, fantastic, and I'm drinking green tea every single day. Berberine becoming extensively known, particularly effective in diabetes, but here we know that it helps with the osteoblasts and slows the osteoclast. So all of this. Quercetin comes in lots of your fruits like onions, and that's a vegetable, but apples and lots and lots of them, but onions and apples are probably the highest concentration. Rutin, luteolin, both found in celery. So celery juice, which people have been talking about for a long time, great source of these nutrients to help with bone health. Camphorol and naringenin, which again comes from orange. So any of those concentrates that you get from plant foods can have multiple benefits. Now, the whole part of this is just a part of the bigger program, which is looking at the foods, the physical activity, the herbs and the spices, particularly specific foods like prunes and so on. And it's about integrating this program into something that suits you. So without doubt whatsoever, you're getting a huge amount of information. Check out all the videos I've got on osteoporosis. They can all help just that little bit. And of course, make sure you subscribe to the channel and share it so we can get this information out there.